everyone. Thank you for tuning into my channel. This is Samantha from Samantha's Respiratory World. Today we're going to talk about part B of the anatomy and physiology of the upper airway. And this will include our final video for the upper airway. So without further ado, let's dive in. Alright, so the first part that we're going to discuss in this video is the pharynx. There's three parts of the pharynx that we're going to break down and go over. There's the nasopharynx, the oropharynx, and the laryngopharynx. So let's get started. Okay, so let's start with the nasopharynx. This is located between the posterior portion of the nasal cavity and superior portion of the soft palate. And here lies these structures. The first one is the pharyngeal tonsils. It's located posterior of the nasopharynx, and it's also known as the adenoids. And what this is a large mass of lymphatic nodules, and it protects us against bacteria and other harmful things that enter through the nasopharynx. And when it's inflamed or swollen, it can completely block the passage of air between the nose and the throat. The next part that we're going to be traveling down to talk about is the pharyngotympanic tubes, which is also known as your auditory tubes, formerly known as auscultation tubes. And these are located on the lateral surface of the nasopharynx, runs downwards to connect to the middle ear, and it's usually closed and flattened. But when they're swallowing or yawning, the tubes open for a brief moment to equalize the pressure in the middle ear cavity. And this is resemble like a popping. And you commonly see this during flights or when you're traveling through mountains. And when there's inflammation in the middle ear, it is known as otitis media, which is another word for ear infection. And just to let you know that for testing purposes, especially when you go to take your MBRC test, you need to understand all these different vocabulary terms that can be thrown and mixed in, because they're not just going to say an ear infection. They're going to say the patient has an otitis media. What do you suggest for that patient? And you need to know that it's an ear infection and that you're going to give them an antibiotic of some type. So just giving a heads up on how that kind of plays in and why it's important to know and understand all these different vocabulary words and what other things could be called. And as you can see in the nasopharynx, the cell structure that you'll see is the ciliated pseudostratified columnar epithelium. And as you pass through the nasopharynx, you're going to come down into the oropharynx next. And this lies between the soft palate superiorly and the base of the tongue inferiorly. And this is at the level of the hyoid bone. Palatine tonsils can be seen here, as well as the lingula tonsils, which is loosely associated collection of lymphatic nodules, and it's located on the posterior base of the tongue. And then you can also see your vallecula epiglottic at this point, which is located between the glossoepiglottic folds on each side of the posterior oropharynx. And it is an important landmark when you're inserting the endotracheal tube into the trachea. And the cell structures that are seen in the oropharynx is the non-ciliated stratified squamous epithelium. The next section after going through the oropharynx is the laryngopharynx, and is also known as the hypopharynx. And this lies between the base of the tongue and the entrance of the esophagus, and the epiglottis is upper part of the larynx, and it's positioned directly anterior to the laryngopharynx. And the arytenoid folds, which is a mucous membrane fold that extends around the margins of the larynx from the epiglottis, and it functions as a sphincter during swallowing. Next, we have the laryngopharyngeal musculature, And this houses the sensory intervention from the 9th cranial nerve, which is the glossopharyngeal nerve, and the 10th cranial nerve, which is known as the vagus nerve. And when these are stimulated, nerves work together to produce a pharyngeal reflex, which is also known as your gag or your swallowing reflex. This helps prevent aspiration of foods and liquids, and it prevents the base of the tongue from falling back and obstructing the laryngopharynx when we are falling asleep. The major structures that you will see with the laryngoscope when you're intubating is your epiglottis and your vocal cords and your esophagus. And here is a picture of all the structures that we were just talking about. So during intubation, you're going to visually see the vocal cords, and you're also going to be holding the epiglottis back to see the trachea. And that is going to allow you to insert the endotracheal tube in the proper place. Next is the larynx, which is located between the base of the tongue and the upper end of the trachea. This is commonly called the vestibule opening into the trachea from the pharynx. Interior of the larynx is lined with the mucous membrane, and the three functions of the larynx is it acts as a passageway of air between the pharynx and the trachea, and it serves as a protective mechanism against aspiration of solids and liquids, and it helps generate sounds for speech. Alright, now we're going to talk about the cartilages. There are 9 cartilages altogether that are held together by intrinsic and extrinsic muscles, ligaments, and membranes. So here we're going to be discussing the single cartilages, which is your thyroid cartilage and your cricoid cartilage, your epiglottis cartilage, and then you also have paired cartilages, such as your arytenoid cartilage, your corniculate cartilage, and your cuneiform cartilages. I'm not exactly sure if I'm pronouncing these correctly, but as long as you know what they are and where they're located at, and know how to spell them for your test, you're going to do just fine. Alright, so like I said, we're going to talk about the single cartilage first. The first one is going to be the thyroid cartilage, and this is also known as the Adam's apple. It is the largest cartilage of the larynx, and it's a double-winged structure spreading over the anterior portion of the larynx. The superior border has a V-shaped notch known as the thyroid notch, and the upper portion of the thyroid cartilage is suspended from the horseshoe-shaped hyoid bone by the thyrohyoid membrane. And the second single cartilage that we're going to discuss is the cricoid cartilage. It is shaped like a signet ring, and it's located inferior to the thyroid cartilage, forming a large portion of the posterior wall of the larynx. The inferior border is attached to the first C-shaped cartilage of the trachea, and it is the one that's highlighted in purple in the picture. And the third and final single cartilage that we're going to be discussing is the epiglottis cartilage. It is a broad spoon-shaped structure, and it prevents aspiration of foods or liquids by covering the opening of the larynx during swallowing. Located at the base of the tongue, connected by the folds of the mucous membranes, forming the small space, this is known as the vallecula. And the vallecula serves, as I said earlier in the video, it's an important anatomic landmark when you're intubating and inserting the endotracheal tube. And in the next slide that you're fixing to see is how the epiglottis cartilage actually works and functions to protect our airway. Now we're getting into the paired cartilages, and this one is the Arytenoid cartilage, and it is shaped like a three-sided pyramid, and at the base of each one it has a projection known as the vocal process, and the base of it also rests in the superior surface of the posterior portion of the cricoid cartilage. The apex of each cartilage curves posteriorly and medially and flattens for articulation with the corniculate cartilage. The vocal ligaments, from which the medial portion of the vocal folds attach to the vocal process. Now finally getting into the last two paired cartilages. First one is the cuneiform cartilage and the other one is the corniculate cartilages. And the corniculate cartilage is a small accessory cartilage that's closely associated with the arytenoid cartilage, and they both lie superior to the arytenoid cartilage. And the cuneiform cartilage is embedded within the arytenoepiglottic folds that extend from the apices of the arytenoid cartilage to the epiglottis. It more likely acts to help stiffen the folds. Alright, now we're getting into the interior part of the larynx where the vocal cords lie. And the vocal cords are made up of a mucous membrane that forms the two pairs of folds that protrude inwards. The upper pair is known as the false vocal cords. They play no role in vocalization. And your lower pair functions as your true vocal cords. And this is how we produce speech. The medial border of each vocal fold is composed of a strong band of elastic tissue that is known as your vocal ligament. And anteriorly, the vocal cords attach to the posterior surface of the thyroid cartilage. Posteriorly, the vocal folds attach to the vocal process of the arytenoid cartilage. And just so you can see, the top part of the picture is your anterior side, and the bottom part of the picture is your posterior side. The final section that we're going to be discussing about the larynx is your rhimaglottitis. And this is spaces between the true vocal cords. In the adult, this is the narrowest place in the larynx. In an infant, the cricoid cartilage is the narrowest point, just so you know. And this is where you're going to be placing the endotracheal tube, is in this area. Alright, finally getting into the musculature side. And the first one is going to be the extrinsic in the laryngeal area. And they are broken into two groups. And the first group is your infrahyoid group. And there are 4 different muscles that are in the top picture. And they are all 4 color-coded. So you get a better idea of where they're at. And their function is to pull the larynx and the hyoid bone down to a lower position in the neck. Alright, and in the second group, you have your suprahyoid musculatures, and those are listed as well. And their function is to pull the hyoid bone forward, upwards, and backwards. And this can be seen when someone is trying to swallow. Alright, now we're getting into the intrinsic musculature of the laryngeal, and this is to control the movement of the vocal cords, and there's quite a few of them, so we're going to take them one at a time. First is your posterior cricoid muscle, and this pulls inferiorly on the lateral angles of the arytenoids, causing vocal folds to move apart, which is known as abduct, allowing air to pass through. Then you have your lateral cricoid muscle, and this pulls laterally on the lateral angles of the arytenoids, causing the vocal folds to move together, which is adduct. And then you have your transverse arytenoid muscle, and this pulls the arytenoid cartilage together and thereby position the two vocal folds that they vibrate as air passes between them during exhalation, thus generating the sound for speech or singing. Next, you have the thyroid arytenoid muscle, and this contraction pulls the arytenoid cartilages forward. This loosens the vocal ligaments and allows a lower frequency of phonation. Last is the cricothyroid muscle, and this can swing the entire thyroid cartilage anteriorly. Additional way to tense the vocal folds and thereby change the frequency of the phonation. Alright, finally, we're getting into the ventilation function of the larynx. The primary function is to allow air to come into and out of the lungs, and during inspiration, your vocal folds move apart, and this widens the glottis, and upon exhalation, the vocal folds move slightly towards the midline, but always maintain an open glottal airway. The second vital function is for effort closure during exhalation, and this is also known as the Valsalva's maneuver, and its massive adduction of the laryngeal walls include both true and false vocal folds. Thus, the larynx is tightly sealed, preventing air from escaping during physical work such as lifting, pushing, clearing your throat. And there's other examples that I have listed in the slide, as you can see. But that is the end of part B. Upper airway is done. The next video that we will be looking at is your lower airways. So thank you guys for watching, and I hope you have a wonderful day. Thank you.